going to what? Rinse the patient and dry it. Why? So that what? We won't be what? Using so much gloves. Okay? Then if you have seen in the video, this is the method on how they put the mitten. Like the one that we use in your tongue depressor, right? Yeah, in the middle and in the middle. Then fold, then tuck it in. Since I have very cute hands, it's not applicable to me. And that is why I'm going to teach you the other method of actually cleaning the. Okay, I don't use that one, that method. I use this method. I'm going to place the towelette in 4 quarters. Why? In this position, I'm going to fold it twice. Why? So that I could continue using different parts of the towelette. Yes. No need to what?
Change every time.
Change every time, rinse every time, because that will be also very difficult for your patient. How do you clean the head part of the patient? Sir, can you put this down since I am here? This side this, please. This side this, the side this, the side this. Really good smelling body wash, huh? Okay. Now, it is already in 1/4. I am now going to wipe Philemon's head without removing the underpad here, because there is still a tendency for what? For it to be, the linen to be soiled, right? So, I'm going to swipe the patient's what? From the forehead towards the nose, over the mouth, and of course on the chin. Now, if this is really soiled, I'm going to use the other part of the towelette and just what? Glide the towelette on the face of the patient, of course, with the ears included, with different parts, and of course also the neck. That's why the purpose of this one is for you to actually what? Change or use different parts of the towelette. Did I now clean the patient's what? The patient's face and neck. And during this time, Sir Dante will now rinse the patient.
Same procedure.
Same procedure. But you will start it from there, on their side. Also prepare your, the other, what is, dry linen. Dry towel.
Can I continue on?
It's okay. Uh-huh.
Change one.
Mm-hmm. Sir Dante is not so good at wiping, right? It seems he's not doing chores.
It means that is not caring baby.
No, it's deeper. Not like this.
baby is very cooperative.
Here.
Yes.
Inside also.
No. Inside?
Ah.
What do we put inside?
Not much.
Outer area.
My gosh, your Dante, you're so malamya. You're like a lady. And I'm a lady.
That's it. It's that.
There's still, oh. There's
There's, yeah,
still.
I didn't like that. Other ear.
Sorry, Kilimon.
Yung tenga mo sa loob ay
Ito?
Because in real life, it's going to be like this also. You have to put a little pressure on it. It's still so closer. My gosh, your Dante.
I'm scared of Kilimon, no?
Too scared. Philemon is very cooperative.
Okay. If you finish, you're finished. Now it's time to dry the patient. Now,
Same, no?
how do you dry the patient? It's a different version. You're not going to wipe the patient. You're going to pat dry. Do it. Still in an S motion. Why? Why is it an S motion? So that it's just going in one direction.
So returning S from opposite side.
With your face. No, I want to care.
No problem. Continue. please.
One side to care. but-
Yes, yes.
Also the ears, don't forget.
Not ears first. Ears.
Finish?
Ano?
Not towel, patient face.
Finish? Okay, this time, you're going to now remove the what? The underpad. Why? Because we're now going to move the underpad. If it's soaked, you're going to what? Dispose it. But for the sake of the return demonstration, reuse. Where are we going to put this one next? We're going to put it where?
Hand, under
Yes,
hand.
under the head. But before that, we're now already cleaning what part of the body?
Head. Oh,
I will change gloves, huh? Imagine I have changed gloves.
so if
We're now going to what?
Each part need to change.
Yes.
That's
Usually,
fine.
if you're the one who's wiping will not change if the person who's drying and rinsing will do the part well. You okay? Do the part well, huh? But since he doesn't know what he's going to do,
this time we need to provide privacy blanket. or-
yes. This time you also have to do what? You have to use the blanket to a patient. Can you get that Philippine Airlines?
Then
Philippine Airlines. So many students.
Before removing the cloth, we need to
Yes.
provide, right? From inside.
That's right.
So
Only expose
patient
the
feel-
areas that are available. But I don't like to use this one because this one they are using for a different for this. It's okay. Just for example, for the demo, we have what? We use a blanket to the patient. Because normally, for breaking BB, you have the blanket. It's up to you if you're going to transfer, change it into the bath blanket. That's the purpose of your bath blanket. Now, coming in. Usually you use the blanket. It's already, they have here what?
Underpad.
Yes, it already has the under pad. Okay? Now, during this time, you can now either unclothe him, so to expose his chest, or you could also remove one piece of the clothing.
Actually,
Only this one side.
Which side we are?
Which side is easier to clean? Which side is what? Okay.
So this is the time Suleiman hand is broken, huh? Now I know.
Yes, this is the time that it has been broken. Now, if there is already an underpad, usually it has already an underpad under the chest, under the back, it will be no problem. Why? Because you're cleaning what? The chest area. Same concept. Who wants to try?
S. S motion, mama.
Yes. Still in S motion, you will start where? In the shoulder of the patient.
Smile. And right?
No, I just wearing gloves maybe after.
Nice.
Shampoo is very good. It's smelling like a perfume.
Yes, S motion also.
More to the shoulder, to the isa.
Later, only this one,
Just
the
for-
clavicle. Okay. So, in some cases, since Phil here is a man, what if, ma'am, it's a girl and the mountains are big? What do we have to do? If the mountains is big, what you're going to do is take this one. You already clean the around the nipple area. And assuming the breast is big, you're going to what? You're going to move it and of course clean it under. Why? Is there a chance that there's still bacteria in under? Yes, that's why if you're going to wipe it, it's like so. Okay? U, W.
Okay.
Yes.
Example, female. Philomena.
No need. Later.
Right.
Dry.
I'm always one with the water than the dry. Like,
Now for the water, the concept for the water, if you know that it's already fully soaked, that's why you have what? An extra water on it, you change it. Now if the patient is in a private room or in a semi-private, there's always a comfort room, you can change the water there. Because sometimes, the temperature of the water is what? Too cold already, so
Yeah.
that the patient what? Cannot bear it as well. Yeah. Right? For me, I like what? Warm baths. Why? Because it relaxes the muscle.
Plus 100 degree Fahrenheit is 105.
What? Can you give me the measurement? Because you
105 degree to 115 degree Fahrenheit.
Celsius.
Celsius is in between 38 to 41, 42. I'm not sure that one, but Fahrenheit I remember. Is in here or I'm very far?
Right, 40.
40.
40 above. Drying? Okay. Now, since Sir Dante is finished drying, I'm going to expose the patient so that you could see him. But usually, you cover the patient per part. Okay? Now, using your what? Underpad. Now, since there are 4 of you, you have to talk which one of you is going to clean who. Which part, which leg, which head, which face.
Come everyone.
Yeah? Who's going to clean the chest, who's going to clean the back, who's going to clean the head, who's going to do the face, who's going to do the mouth, and of course we also have your what? Perineal care. Okay?
Lamentation.
Baka mas mabilis tayo.
Okay?
Basta S na.
Yes. Okay. For this one, I'm not going to show it much so that we could be very, very fast. You can do some practice still on your occupied bed making.
Kami will do today.
Yeah.
Ah, occupied na.
Yes. Because you're going to do it with your hygiene and your cleaning. That's why I also prepared it there. Okay. For this one, you have to remember that it's what? Starting on the shoulder, it's 1 stroke down. 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 To the palm. To the palm. What else? To the fingers. Different part. The fingers in between, different part. In between, different part. In between, different part. In between, different part. Why? And of course, your last part would be the yes. Pincer. Please.
That's one stroke mo. Ay,
Ako na-picture.
1 stroke only, going down.
Yan.
Ma'am, do we have to put an underpad on each extremity? Yes.
Nasaan na yun?
ay, magkikili pa lang yan.
Yung finger na.
In between first.
In between finger.
Naubusan na ako.
Yan.
You know, I'm going to look for Filomeno and Filomena's, you know what I'm going to look for.
Armpit.
Na-try mo na.
Okay, dry it first. It's your armpit. Of course, genital.
One stroke mo pala.
What is perineal?
Who will be the patient?
Wala nang patient.
Dili man.
Sige lang.
It's okay na si 1% there,
Yeah,
1%
better.
here.
Kasi
Okay,
pag marami tayo
At a time will-
may ano, may patient. So, sinong maglilinis? Gusto mo kami na lang dito.
Ah, kala mo per ano na.
Per part daw eh.
Per part
Tag-iisa
na.
tayo eh.
O di kung saan ako nag ano, sa dipid na ako.
Sige. You will clean this side.
You are
You will
from
clean this
here.
side. Ha?
Yeah,
Ikaw
you
sa
and me
ulo.
one side, okay?
Ikaw,
Hindi, dito kayo, di ba? Kami maglilinis.
saan pa ba? Ah, sige.
One
Sa
side
ulo.
we will be and one side you guys. So it's okay
Sa
now.
baba.
Sa ulo kailangan dalawa.
May kasama,
dahil
oh.
May pag ano.
O, dalawa pa
maglinis
rin
siya
dito. Dalawa din dito. So, tayo ng partner. Tayo ng partner.
Sabay-sabay na ba?
Sabay-sabay.
Oo nga, per part na nga. Sinabi mo na
Oo
kanina.
nga eh. Ang gulo mo magkwento eh.
Hindi.
So, we will, when we do the demo together,
Oo.
Yeah,
so,
all together.
then we will
in a
divide
part-
the parts.
In
Yes.
a part kami na sa...
I asked, I told her them We will do
So,
the lower.
itong part
Ah!
itong
Tuloy sa
part na
lower.
sila.
You're the
Oh, it's okay.
part and
You
you're
and
Then
me
we'll
will
do the
side.
upper.
They are, yeah.
Siguro nagkakaroon dito ng dibdib siya. Kasi natatanggal siya eh. No?
Ano yung sinabi na kanina yung pag mag-wipe pag malaki yung bibig?
W.
Itataas mo siya.
yung ano.
Ay, gabi.
Para kasi di ba dito?
Under.
Sa ceiling.
How's the Philemon, lungs, heart, everything is okay? Good.
Don't have liver. Don't
Eh?
have.
Oh.
No, ano na yung maliit?
Nasiro.
Pancreas?
There is
Yung
no
abdo?
stomach.
Screen?
Yung abdomen ang tawag doon?
Spleen ba
One
yun?
lungs and heart. Ah, stomach is this one.
No, ano tawag ng abdo?
Spleen nga daw.
Ay, spleen ba?
Ay,
Nasa ano?
What we are looking for.
We are checking if this is complete. Complete lungs, heart,
Saan natapos ang ano?
pancreas. Meron ka pang ano.
Well, we will eat after siya.
Where we know? Where we
Kakain ba tayo? After?
I'm too much tired.
Let's eat
yeah.
outside after. Uy,
Alam mo bakit niya umuwi? Kasi ang ganda ng earrings.
Sabi ko nga pa, sabi ko sir, pwede siya sa ano eh, sa
Pilipinyana.
Pilipinyana kasi pearl.
Pag-ibili ko niya naman.
Hindi na.
Parang naghahanap ako ng
Oh,
parang-
video is
Meron
to
gusto-
continue with running.
Ikaw ba yung saan